For a fast exam with a focus of effusions, there are 4 abdominal transducer locations and 2 thoracic locations. The transducer index points toward the patient's head, or sagittally, in all locations. Alcohol is used as the wetting agent for the transducer instead of ultrasound gel. As you watch this DVD, practice placing your transducer in the described location on the abdominal graphic and fan at each location as described. For the subxiphoid location, number 1 on the graphic, a small amount of alcohol is placed to the patient's right side of the xiphoid, and then the transducer is placed there. The transducer is pointed cranially to look under the ribs. The transducer is fanned slowly to the patient's right side, and then reversed to fan slowly to the patient's left side. The diaphragm is a thick, bright white or hyperechoic line between air in the lungs and the fluid density of the liver. The liver is a homogeneous tissue density caudal to the diaphragm. The gallbladder is a black or anechoic balloon or teardrop-shaped structure to the patient's right side of the ventral midline and surrounded by liver. When fanning to the patient's left side, the heart is often seen on the thoracic side of the diaphragm, opposite the liver. In this location, black or anechoic effusion tends to gather between the diaphragm and the liver and caudal to the liver. Intestines and mesentery tend to fluctuate or bounce when effusion is present. Effusion gathers between liver lobes. As you fan the transducer to the patient's left side, the beating heart is often seen on the thoracic side of the diaphragm. This is often the first opportunity to see a pericardial or pleural effusion. In this case, the black or anechoic pericardial effusion is between the diaphragm and the heart. A small amount of alcohol is placed very dorsally at the last rib on the patient's left side for the left upper quadrant, location number 2. The little finger of the transducer hand is used to trace the last rib on the left as far dorsally as possible. The transducer is placed there and fanned slowly ventrally and then reversed to fan dorsally. In this transducer location, the left kidney is a mixed echoic structure. It has a gray cortex and a dark medulla. Sometimes the spleen is seen at the left upper quadrant. It is a homogeneous tissue density similar to liver. This video shows a large amount of black or anechoic effusion around the left kidney. Intestines and mesentery are to the left of the kidney. The spleen is not present in this case. A small amount of alcohol is placed just cranial to the pubic bone, and then the transducer is placed at the prepubic location, number 3. Fan the transducer slowly to the patient's right side, then reverse and fan to the patient's left side. In this transducer location, the urinary bladder is seen. It is an anechoic or black structure containing urine. The descending colon is usually strongly echoic or bright white on the surface with a dark acoustic shadow below it. In this video, the white line or hyperechoic wall of the bladder is seen to the right. The bladder is filled with black or anechoic urine, but anechoic fluid is present outside of the bladder as well. Notice how the intestines and attached mesentery seem to float or fluctuate in the effusion. A small amount of alcohol is placed very dorsally at the last rib on the patient's right side for the right upper quadrant, location number 4. The little finger of the transducer hand is used to trace the last rib on the right side as far dorsally as possible. The transducer is placed there and fanned slowly ventrally, then reversed and fanned dorsally. In this transducer location, the right kidney is seen. In dogs, you may also see the caudate liver lobe. In this video, the right kidney and intestines are to the right side of the ultrasound screen, and liver lobes are cranial to the kidney. Anechoic or black effusion is outside of these major organs. A small amount of alcohol is placed on the right lateral thorax, close to the sternum, and about 3 rib spaces cranial to the xiphoid for the right lateral sagittal location, number 5. Place the transducer there and fan slowly ventrally and then dorsally. Here you see large dark rib shadows because the ultrasound beam does not penetrate the bone. The beam is completely reflected by air in the lungs, so you really do not see lungs, just a white fog of reflection from the air. Normally, air in the lungs would block your view of the heart. In this video, black or anechoic effusion is outside of the heart and a collapsed lung lobe is bouncing against the heart. If structures such as lungs, clots, or fibrin tags are actually touching the heart, a pleural effusion is present. If you are not sure if there is a pleural or pericardial effusion, put a needle in the effusion and get a sample. Pleural effusion is usually a transudate or modified transudate. Pericardial effusion is usually blood. When pericardial effusion is present, a bright white or hyperechoic line usually surrounds the anechoic fluid and the heart. This line, or pericardium, prevents lungs or fibrin tags from directly touching the heart. Collapse of the right atrium only occurs with pericardial effusion and is known as cardiac tamponade. It does not occur with pleural effusion. A small amount of alcohol is placed on the left lateral thorax close to the sternum and about 3 rib spaces cranial to the xiphoid, location number 6. Place the transducer there and fan slowly ventrally and then dorsally. In this location, you will also see dark rib shadows and white fog of reflected air from the lungs. But the heart is closer to the thoracic wall on the left, and you will see glimpses of the beating heart. From the left side of the thorax, you normally would see the heart, but not the black or anechoic free fluid seen outside of the heart as in this video. Again, collapsed lungs or other structures can be seen touching the heart and indicating a pleural effusion. In this video, black or anechoic effusion is on both sides of the bright white line of the pericardium. The pericardium prevents lungs or other structures from touching the heart. The anechoic fluid outside of the pericardium is pleural effusion.